Hi, my name is Graham Mackay-Coghill and I'm the Director of Link Rehabilitation. Today's video I'm going to teach you how to manage your shoulder following a rotator cuff repair. Just a little bit of anatomy on the rotator cuff. The rotator cuff is 4 tendons. We've got one in the front, one on top and 2 in the back. The majority of you will have the top tendon supraspinatus repaired, but sometimes it's also done in combination with other tendons. You'll have a keyhole incision at the back, and you'll either have an incision down the side or an incision down the front. You'll have steri strips on, and then you'll have a waterproof dressing so you don't have to worry about showering. Immediately post-surgery you'll wake up and you'll be in a shoulder sling, and your arm will be paralyzed and numb for about 10 to 15 hours. That numbness stems from the block that they give you in surgery, and it's to reduce post-operative pain. There are a few contraindications or things that you really have to be careful of post-surgery, and the most important is that you don't lift your arm against gravity for the first 6 weeks. You're very welcome to bend your elbow, but we really want you to avoid lifting the arm away from your side at all times. We'd like you to sleep in your sling for the first 2 to 4 weeks, or at least until the surgeon or the physiotherapist allows you out of your sling. In terms of exercises, it's certainly not important to start exercising straight away. There's a misconception that early mobilization prevents frozen shoulders, and it has absolutely no foundation whatsoever. So my advice to you is you start exercising when you feel ready, which may be the day following surgery. Your primary exercises are to cradle your elbow, lean well forward, and do some gentle pendular movements. If you're a right-hander, I'd encourage you to move in an anti-clockwise direction, and if it's left-handed, I'd encourage you to move in a clockwise direction. The secret of this is to lean well forward and bring the arm into the side, and obviously to do it in a pain-free manner. 4 or 5 times in one direction, 3 or 4 times a day would suffice. You're also very welcome to bend your elbow up and down. I'd encourage you to do it in a hammer position, so you're not in that position. You're in a neutral position. You can do some hammer curls, and you can do 4 or 5 times, several times a day as well. You're very welcome to do some shrugs, and I'd encourage you to do it with some deep breathing. So you basically take a deep breath and just relax your shoulder down, basically just to relax your shoulder girdle so you don't get too tense through your neck. I'd like you to come out of the sling several times a day and just let your arm hang by your side. There's absolutely no problem with your arm hanging by your side. It doesn't put any extra tension on your rotator cuff, and if you want to, you may even want to put your hand in your pocket, which will actually stabilize your shoulder. For most of you, you're going to want to be out of the sling a little bit, and you're going to want to be in the sling a little bit, but my rules are for the first 2 to 4 weeks I'd like you to sleep in your sling, and certainly when you leave home I'd like you to be wearing your sling so other people don't come up and touch you on the shoulder. It's really important that we promote pain-free management. Anything that hurts is certainly not going to do you any favours. The hardest thing after a rotator cuff repair or any shoulder surgery is sleeping. And I would encourage you to just trial different sleeping postures. Sleeping in an upright posture is generally more comfortable, and one of the reasons for that is because we've got more space under the acromion when the shoulder is in an upright position as opposed to lying down. The other reason is we have more pain at night, is blood tends to collect in our chest and shoulders at night. There's more of an inflammatory response at night, whereas during the day we're walking around, a lot of blood's in our legs. So generally sleeping upright tends to help that process. Options for sleeping upright are sleeping in a recliner, even using a beanbag in bed is not a bad option, propping yourself up in bed. But by the same token, you're very welcome to sleep on your back. If you're going to sleep on your back, sometimes a pillow resting underneath your arm is quite helpful. And obviously you can sleep on your other side and rest your arm on a pillow. In terms of brace management, I'm going to show you an effective way that I think a brace can be put on and taken off. This is a standard shoulder sling. It's got a top strap and a bottom strap. I'd encourage you to just place it on your hand like that. Come over the top and you can pop that in there. And then this is still attached. Just put this over your head. The blue's always on the outside. You can then adjust it to where you want it. Pulling that really makes your elbow nice and snug. And then in terms of getting hold of the back strap, if you walk up to something and just turn around, it'll just be sitting there and it'll be easy to place onto the sling. There is a thumb strap in here. I'd really encourage you not to use the thumb strap. I've actually seen a couple of paralysed thumbs in my time, and I'd like the wrist and hand well supported. You can wear the strap at any level. You can play around with where it's comfortable. When you take the sling off, I'd keep that intact. I'd take the waist strap off, and then I'd lean well forward, and you can take that off your head, and you've taken the brace off in a safe, comfortable manner. In terms of dressing, I'd encourage you to wear buttoned up garments or zipped up garments. They're just a lot easier to put on. If you're going to put your shirt on, put your right side in first, and then when you take it off, take your left side off first, and the right will just come off automatically. When you wash under your arm, put your hand on your thigh, and you can slide your hand down and you can access your armpit in that fashion. And I'm also happy if you do it very slowly to come across and you can wash under your opposite arm in that fashion there. In terms of driving, I prefer you guys not to drive until you get some medical advice. Even if you have power steering and automatic transmission, we'd encourage you just to wait and get advice on driving. I'd like you to trust your own judgment, and I'd very much like to stress pain-free management until you catch up with either your surgeon or your physiotherapist post-operatively.